Here's what I wanted to do. I read an article recently because it came out. And so, being in the present space and being someone who's trying to provide support and help and offer conversations and offer some things and see what happens with them. And sometimes people like it and sometimes they don't, but it typically gets people thinking, at least, which is part of my mission, is not to shove things in people's faces, but to offer things and see what happens. And an offer is different than an offer in my world. I offered an article when we were talking about having a conversation, and I'm curious if you wanted to sort of share what the title of the article was anyway, and sort of what we might do with that particular piece, because I did share a piece with you that I thought might be something for a courageous conversation, but then we've already had our courageous, maybe the first one anyway, we've already done one courageous conversation, which I think was helpful for me and hopefully for you out there, not just Karin and I, but many people, because that's what these are about, is us being out here and people being aware that we're out here. And we're willing to have these. So the article that I shared with you, if you could just sort of give us a heads up on what I decided to put out there, which was an offer. And again, it's couched as an offer. It's like, we could do this or we could do something else. Right. So yeah, so go ahead, if you would, and share what I offered.
I'm going to just read the title of it because I want to make sure I get it correct. But you sent an article posted on McKnight's Clinical Daily, a piece by, I think it was Alicia Lisak.
Yeah.
About data that Medicare and Medicaid, their national data review system, and I think it was Pennsylvania's Medicaid system, had noted that nursing homes and assisted living facilities had that the populations in those congregate settings with people who were basically not white had 2 to 4 times the rates of COVID-19 and had a higher percentage of deaths due to COVID-19. And that the article pointed to the higher incidence of these outcomes because the people there also had higher rates of comorbidities like COPD, diabetes, obesity, or dementia. And these factors lend themselves to therefore having poor outcomes. The article basically was encouraging state and federal governing officials to spend more time addressing health disparities. And your response to it was immediate. And the point was, as you commented, was this was stating what we had known to be true, and the reality that, no matter what the person's skin tone, to be quite frank, that if you have any comorbidities or health challenges to begin with, you are more susceptible to having a negative outcome when you're stressed by something like a virus, in this case COVID-19, or any other thing. And so the real question you were leading to was, well, what do we do about the real underlying cause and the fact that it transcends so many other issues beyond just COVID and being in that nursing home facility. Is that pretty much a quick synopsis?
Yeah, that's a great synopsis. You did a fantastic job. I can see that public health background coming out. I mean, absolutely. I mean, I'm just really, okay, I got it. I mean, I already had that part. And none of that was a surprise to me. Mm-hmm. Because if you're, for those of us who are keeping track, it's like, well, yeah. I mean, that's the data that supported what those of us who have been involved. I mean, I've been around 40 years. I mean, this is no surprise. I mean, I've worked across, but in the U.S. I mean, it's in lots of places.
But maybe news and new.
Yeah, I know. That's sad to me that it's still news, because this is not new information, but it's coming up, and that's good. And I'm not saying it's not good that it's being presented in the public eye. It's just, having been around so long, it's like, oh, yeah, okay, here we go, I know.
So I'm going to interject for a minute, Teepa, to remind you that you have been fortunate that you have been trained to have eyes wide open, to be attentive, to be observant, to be intentional with that observation. And whether it's, just the challenges of living and life and whatever, or truthfully just the bubble that you've been nurtured to live in, you have been conditioned to pay attention and to observe these things, and a lot of us have been conditioned not to be attentive to those things. Not good or bad, just it's a statement and a reality.
Thank you.
And so again, I think it's really important to know that if you want to be a scientist, if you want to be just a really great citizen, or if you just want to be on top of things and engage with your world, you have to engage and be observant and be intentional with that observation. Otherwise, you will miss critical things. And I liken it to, people say, I can't handle the news and there's too much. But at some point, you are poised to pay attention to some things going on around you so you know what to do the next day. Do I look up at the sky and see that it's gray and dark? Do I listen to the weather report? I use some things to help me filter and process the world around me. And that goes back to my challenge again to people and myself every day. I have to be intentional about looking for those things that I monitor and observe to tell me about the world going on around me. And I have to be intentional about looking for things that are outside of my little space, because my space is always affected by the other spaces around me. I know we don't always believe that, but I can guarantee you that what happens 5 doors down from me absolutely affects what happens to me.
And to see everything as all good or all bad or all this or all that. I mean,
we're not absolute.
There's never alls. Alls is, you might as well start looking for the exception to all, because there's always going to be an exception. Is my belief is like, wonder where it is. And of course, that gets my curiosity going. Okay, so where does this not fit?
Yeah, you can cut out that we're not all absolutes, because I don't like the concept of that for some people. But yeah, you're right on target, Teepa.
Yeah. So one of the things I sort of asked is, wow, so how do we start? And, I know that part of it is having conversations. And that to me speaks really, I'm going to do the timeout, not regulations. I didn't see more regulations. I don't see more rules. I see open conversations. But if we're going to do that, we have to lay some things down, or at least put them to the side so they aren't weapons in our hands, but rather I come to you with open hands. And I'm really curious about what you're going to say. And I really, when I ask, I've got to ask with, help me better understand how we got here. I need, from your point of view, how did we get here? Because we've been having this happen. It's not a brand new phenomenon. I mean, this has certainly made it so significant. But people, there have been these disparities for a while. And my awareness of who's working in these buildings and what they're being paid for the different tasks or jobs they have. And then who's working in which buildings and who's working in what systems. It's all to me, linked in ways that are open. Then what if we disconnected a couple of these links? What would happen if we just disconnected? Okay, well, before we disconnect those, do we need to create a new link so that when we let go of those, that's still going to be there? And to me, that's one of the highest risks, is if we just break this link and we don't do anything else, what does that unintended consequences? And that's how I think we've gotten to where we are right now, is so many, in some cases, I truly believe unintended consequences. In others, they may have been intended, but they weren't intended by me. But I mean, I don't know about others. And if there was an intention behind it.
Oh my goodness. You're just tapping on so many things and my brain's just firing, because you're highlighting there's such complexity into the why we are dealing with some of the things we're dealing with, although that gives us an easy out.
Yeah, and that's not what I'm looking for. I don't want an easy out.
I'll be honest. I'm gonna reduce this, simmer it, saute it, whatever the word is that you want to use.
A little dip, and let's just take a little dip out of the bucket. And let's look at this little dip.
Yeah. I'm going to say we are where we are because we at the end of the day, Teepa, I have to choose to care about something or someone else. And the question is, there's not a
Well,
moral.
wait, can I ask if there's a second side? More than myself.
Yes, more than
Or
myself.
at least equal to myself. I mean, if I don't care more or at least equal to you, how can we even begin this if I don't see the huge value in you? And if I don't believe that you provide something in this world that I don't, and that there is so much value in being with you or learning from you or engaging with you or learning more about you, then I don't know how we start a conversation.
But Teepa, so let's step back for a minute, because we always have to step back and understand the experience or the lens we're looking through. And I may have been taught that what, person X brings to the table isn't valuable. I may have been taught that.
I know.
Because of my own experiences, or because of whatever the rationale. There are lots of reasons we've been taught that some things are more valuable than others. And so you're bringing together two different mindsets. And I don't throw moral judgments at them. I'm just saying, be mindful that we all place values on different things for different reasons. And so, the world calls that, again, that lens of experiences. So the world says some of your experiences have or create an implicit bias, or they create, just a bit of a shading of how you're going to look at things. I say you may have some cataracts, depending on whether or not I agree with you. Other people might say I see it clearly, but the reality is we all are bringing the limits of our own experiences as to why I need to value you, or value having that conversation to begin with, because I don't really need to have that conversation, is what some people might say.
Right.
Other people might say, well, I'll listen. But so I'm just saying, if we can help each other to see why we need to have the courageous conversation, I think that's a good start.
Okay.
And one of the whys, again, not a moral judgment, you're highlighting some of the, because everyone's valuable, everyone has worth. And I may or may not agree with that, but some people may or may not agree. But that's one reason. But the other reason, which to me is just simple kind of survival, really.
So I do. Yeah. So
it's survival. Your survival depends on me, and nothing more classic than a pandemic like coronavirus to bring that point to life.
So in some cases, it may not be that you would see the people that I see as having value, unless I can step back far enough and start to figure out how you might perceive them as valuable if I were to first express it to you from where you're coming from as a commodity of value. Rather than a human of value, a commodity, that something about what this person does or is or provides has value to them. You don't see the person as a value. You can't, that's not where you're coming from. But where you can see is if you don't have those people, then you're losing something that does give you a sense of value somehow.
I'm articulating that is a reality. I don't know if I share that belief.
Yeah, I know. I'm trying to wrap my head around it.
As a commodity, but I'm sharing to you that if you looked at it just as raw, this person brings this entity into the equation of my life, then if nothing else, you will pause to step back. And the example might be, for example, the essential workers during this pandemic. You may never have paid attention to someone, another valuable, equally as valued, important human being. You may not have seen them that way. But when you needed someone to get food for you from a farm, or when you needed someone to serve the food or prepare the food for you so you could order it or have it on the shelves, or when you needed someone in our world to meet you in the emergency room and provide care for you, or when you needed someone to wipe your buttocks for
Yes.
your mother or your father or your loved one, because they are now locked into a community, a memory care or an assisted living, then you start to place a different value
Mm-hmm.
on what that person is bringing into your life equation.
Yeah.
I deeply believe that no matter who, what you are, where the world says you stand in status, we all breathe the same air, we use the same toilets, and I'm very visual, so forgive me, but you may want to cut that out. But
You're in good company. I mean, if people aren't using a toilet, we need to talk because.
But you know what? At the end of the day, we all made it through the birth canal somehow.
Yep.
In some way, shape, or form, and we all take a last.
It wasn't pretty from the outside.
But we all take a last breath and we die. So I may need to clean up some of those analogies, but you get the point that I have been blessed to been taught and to believe in a creation and a creator who says that I am just as valued as the other person beside me, and that person is just as valued as I am. So I dare not dishonor them, and they dare not dishonor me. And that frames my perspective. Mm-hmm. However, for those who may not share that, I think it is helpful for people to understand the what's in it for me.
Yeah.
And this speaks to really an important point for me, which is at the end of the day, we argue and fuss because we focus on the me and not the we.
Yeah.
Some people, if you're people of faith, you might say, oh, that's the concept of being selfish and self-serving. Others, a more secular perspective will be literally what's in it for me. Yep. And I'm saying at some point, I think it's helpful to help other people to understand your existence depends on my healthy existence. And if you have been taught to believe that that's not true, you may not appreciate that. So I may be able to connect some of the dots for you. We're seeing that play out right now. But I think that is also a helpful tool, I will say. A helpful tool.
Yeah. And Karin, I've got to say, I think as a courageous conversation, I think this is where we're starting that conversation is if you are in simpatico with me, if we can find so many connections, then it's fun and mm-hmm. exciting and it's encouraging and it's uplifting. But when we have so many really different pieces, wow, it's hard work. Mm-hmm. And the question is, are we up for some hard work? How much hard work can I do before I need to be lifted? I need that lift so I can go back to the hard work. And it's recognizing we're going to need a balance, and we need translators, and we need people who stand somewhere a little closer, a little further, but maybe at least can help us get to that space where the other person is living and decide, can I keep going? Can I maintain, for me, can I keep my compassion, my curiosity going? Can I keep that going, or do I need a break, and can I come back, or do I need to see if there's someone else who could go back? Because I can't. I mean, and I acknowledge it's a failing in me and I'm willing to work on it. But for right now, I can't right now. And I've got to respect that in me when everything I offer up, I say, I don't know what else to try. I need a break, and mm-hmm. I'll let someone else try. I'm not there yet, but there are times when I've been there, and right. I've made that choice because I feel like I keep knocking and nobody's answering, and I don't know what else to offer. So I'm going to take a step back and move away so I don't give up on this. I want to really take it a space.
That's a really important point, that this time of this season may not allow you, Teepa, to get where you think you need to be. But you know what? There's so many other forces at play that help to move us further along in our conversations with each other. And I'm very grateful for them. And sometimes that may not happen within the confines of my time with that person. In medicine, you don't get to have the aha moments, within that 30-minute visit, but that may come along a few weeks later or a few months later, or even a few years later, depending on what's going on. But I value you enough to walk that journey. And I'm trusting all the other forces, grace, patience, all the other things to help us along the way. And, you know, just when I think I may not be able to help have further that conversation, someone else is primed to come in and help have that conversation. Because, you know, we do hear people based on our receptiveness to their trustworthiness and do they speak my language. So, you know, you may hear it differently if it comes from someone who looks like you, who works where you work, who lives where you live, who maybe worships if you are a worshiping person, or who's had the same upbringing as you have, because we are most comfortable in spaces and places where things don't disrupt our sense of balance. And we feel balanced when things around us maybe look like us. They don't look different. And again, this is very true for someone, especially you can use the example of someone living with dementia. They are most at peace and at calm when things around them are familiar, when the routine hasn't changed, when things are friendly. And of course, when there's food involved, it's always
when
good.
there's functional. Yeah, it's functional. I know what to do there.
What to do.
And
So,
I feel forgiven if I make a mistake. Nobody's going
Exactly.
to jump on me.
no one's going to jump on you. And I like to extrapolate that experience with someone living with dementia to how I engage in the world we're living in right now, because I think it reminds us to have that same level of patience and grace and that sense of there's a reciprocal benefit to this interaction. It's not just me doing work and having to give you, you're always saying you need something, you always need, and I'm just giving. No, that person is giving. It is reciprocal. The difference is I'm not recognizing the gift.
Yeah.
And so when I step back and ask, what am I really receiving from this? You'll be amazed at how much that happens.
Well, here's the cool part for today. I don't even need to step back. I will, because I know that by stepping back, I'll receive even more.
Mm-hmm.
But you and your willingness to have this conversation have been a gift.
Thank you.
And to me, this is the quality of the first conversations that we could have and we might want to have. But I want to thank Karin for her willingness to be part of this conversation, because without her, I would not have had so many, ahas, oh my, oh wow, what about? And oh yeah, that. And I'm hoping you got some of those too, because if we didn't get you to think and feel and realize we are all in this together, and we will need each other, and we already have, and we will continue to do so, and finding those spaces and places where we are the people.
Mm-hmm. Thank you,
Wow.
Teepa.
Thank you.
May I share one thing?
Absolutely.
Because I'm suspecting there will be another courageous conversation.
You're so good at this.
I suspect there will be another one, and I'm eager to have that. But I will say, and you can decide if you want this in there or not, but I wanted to share that as I've navigated this experience of people living with dementia in particular, and seeing what's happening in the world around us right now, and with senior living and just how we engage with each other, it has reaffirmed for me the observation I made years ago as I evaluated senior living in general and senior care in this country. And the reality is that our future care depends on the kindness of another human being and the system checks and balances that are in place to ensure certain things happen. But that's it. Yeah. It has not and never has been about how much money you have or don't have, because the wealthiest of people still rely on that person who engages in this caring for them and washing them or helping them get dressed or feeding or supporting them. It depends on their kindness.
And whether they see them as a kindred spirit.
They see them as, exactly. And so I share that because it was a reminder to me that we really want to be kind to each other, because at some point that kindness is what is going to support us.
Yeah. That'll be part of that. And I would say namaste.
Namaste. Thank you so much for your time.
Thank you so much for your time. I look forward to us putting it
Finishing the
out there.
conversation. Yes.
Yeah, having more. Thank you, Karin.
Hey folks, thanks for watching. Please like and subscribe to help us spread Teepa's positive approach message around the world. And don't forget to click the bell to get notified when new videos are posted.